I'm glad to have, a more upbeat report today. I won't say that it's completely all clear signal, but we're at least not sounding the hurricane warnings right now. I'm going to try to, let's see, share my screen. Let me see if y'all see that now. You have that?
We do.
Okay.
It's not the slideshow level, but yeah, there you go.
I got it. All right, let me jump on in. We are coming, not quite yet, but we're coming up on the second anniversary where this threat emerged and disrupted all of our lives. It's still present. I don't want to let anybody think that the all clear signal has been declared, and we still are unfortunately having a number of illnesses and preventable deaths on a daily basis in this state because we haven't successfully deployed and had uptake of the new science that we know does work. But I think in terms of the cataclysmic threat, we're a little bit through the woods. This is the current number of active cases across the United States. You can see we're not as red as we have been before. You've got parts of Utah and all of Nebraska not reporting, but you can see Arkansas and the South is not as red. Tennessee still looks a little red, and parts of Kentucky and northern parts of Mississippi and Alabama. But I think much of our state has lightened up. You can see here, as a nation, we're coming down from our Delta peak. That is also true for our state. We're way down from our peak there in late August, still with 500 to 600 cases a day. We've got 395, almost 400 folks still in the hospital, over 100 on the ventilator, and this is unfortunately because of our vaccination levels not getting high enough and the ubiquity and presence of this virus across our entire state. It is going to successfully infect people, and those that have not been vaccinated are going to have more and more challenges. Here are our new known infections. Again, state is a lighter color than it's been. We do have some continued concentrations of new known infections, particularly up in the Batesville area there in northeastern Arkansas. This is a nice green colored map. We didn't see this 4 weeks ago when I was last with you with our school districts. We've got a lot of our school districts now that are in good shape. If we can continue to kind of have that hold, again, that pocket of hotspot up there in the north central northeastern part of the state is a continued cause for some concern. These are the trend trackers across school districts, and it was 1st of October. We had about 119 school districts in the red zone there. That's dropped down to only 17 last week. You see the green, the yellow, the lighter green coming up. So I think our school districts are coming through the Delta variant threat, although we continue to have some hospitalizations, particularly of adolescents, with weight problems at Children's Hospital. The education department, has actually responded to some of these changes, not necessarily with science, more out of pragmatism, redefining close contact as 3 feet for 15 minutes instead of 6. Really, this is because of the issues around quarantining. They were quarantining so many children at the 6 feet threshold, and then the kids were not testing positive. There are still test to stay protocols so that if you are exposed and you test negative, you can come back without going through the extended quarantine. And any of the adolescents that are vaccinated immediately eliminates the need for quarantine. And if both the case and the contact are masked, there's no need for quarantine. So there's still a strong advocacy through our schools for vaccination of those that are eligible and for continued mask wearing, really in all grades, although I think many of our schools are going to start to relinquish the requirements there in the near future. From our hospitals perspective, as I mentioned, we're off our peak, but we still have 300-400 folks in the hospital. Unfortunately, many of these folks are in the hospital on the ventilator. And I've had conversations over the last month that really, once folks go on the ventilator, the outcomes there are go down significantly in terms of good outcomes. I talked with Troy Wells of the Baptist system yesterday, and he says what's really demoralizing his staff is the folks that are coming in now. We've got some folks that are coming in, breakthrough infections in vaccinated individuals with comorbid conditions. But he goes, it's the 40-year-old moms of 3 that he's got on the ventilator right now that they cannot get off the ventilator for the last 2 weeks, that are really unvaccinated, we're in the prime of life and now are facing a life-threatening battle going forward. We do continue to see increased numbers of hospitalizations in younger folks. We've had a 10-fold increase in hospitalizations in kids less than 18 over the last several months. And again, the 25 to 44, 45 to 64-year-olds, those are the ones that are coming in predominantly now in an unvaccinated state. On treatments, we continue to have remdesivir, renamed Veklury, for hospitalized adults, requiring high levels of oxygen. The baricitinib, these are the older drugs that we had. The monoclonal antibodies continue to be widely available and are effective. We've got a new pill since we were last together. Again, I think they take a Scrabble box and just throw the letters on the table to come up with this. But it's a traditional, more traditional antiviral pill by Merck. It's an oral medication, so you don't have to have an IV. It prevents severe cases that result in hospitalization or death. You take it twice a day for 5 days, and in their trial that they have submitted data for FDA review for individuals that were mild to moderate, it cut their risk of hospitalization and death in half. And so it is going to be before the FDA advisory committee. That may be October 30th instead of November 30th to discuss the EUA, and could be available at the end of this year. This would be kind of a breakthrough if we had an oral medication that for mild to moderate cases, we could cut the risk of hospitalization and death in half. Now, cutting it in half is not cutting it to 0. So that still doesn't mean that we're out of the woods on this. And I would still rather have a 90% reduction in hospitalization and death from the vaccine than a 50% reduction from a medication. But again, new science, new knowledge, new opportunities coming forward. We continue to have investigational efforts on a couple of drugs. We know a couple that are ineffective. And again, I think the testing on vitamins really is not going to give us a definitive answer on that. With respect to deaths, we continue to see 10 deaths, 15 deaths, 8 deaths a day. 90% of those are preventable. And of the bad outcomes, almost all of these are in not vaccinated individuals. The cases, 90% in unvaccinated folks, hospitalizations, 90%, the deaths. We do have individuals that have been vaccinated. As General Powell, unfortunately, was in a situation where his immune system was compromised because of his cancer and the therapy he was undergoing there. So, keeping your family members, your community, your faith-based groups, others that you come together, recognizing that individuals with compromised immune system, even if they're vaccinated, you're vaccinated, if you could potentially be a spreader, it is a risk that is not inconsequential. Since June 1st, we project or suggest that over 1,900 of the deaths that have occurred in our state were preventable, that this number will continue to grow as we have over 50% of our adult population that remains unvaccinated. A new and I think concerning output that I think will only grow: last week, the American Academy of Pediatrics, the Academy of Child and Adolescent Psychiatrists, and the Children's Hospital Association declared children's mental health as a national health emergency. And this builds upon the fact that suicide was the #2 cause of death prior to the pandemic among children. And the pandemic obviously has caused physical isolation, uncertainty, fear, grief. And these organizations see indicators suggesting a major increase in the threat. ER visits for mental health emergencies in the last 6 months rose 24% from 5 to 11-year-olds and 31% for 12 to 17-year-olds. Suicide attempts were up 51%. ER visits for suicide attempts. So these are, active attempts, not just gestures. We're up 51% among girls 12 to 17 years old. And of course, this builds upon the fact that it's projected that over 140,000 kids have experienced the death of a primary or secondary caregiver. Just doing the math, that suggests that probably 1,400 children have lost a parent due to COVID-19 here in the state of Arkansas. I think this mental health, we've talked about it before. We focused on the hospitalizations and the ICU admissions and the intubations and the physical aspects of COVID. We've mentioned it as, duress, anguish, depression, increased drug and substance abuse in adults. I think we're seeing in our kids. I would ask, for you all to really amplify through your networks this issue. I think this is what we're going to be struggling with over the next year or so because of the impact of COVID-19. You've got some great resources up there with the Ozark Guidance Center and other resources. Statewide, the AR Connect program that is a federally funded telephone-based mental health support, so that if someone's having mild to moderate, anxiety, depression, even more acute issues, the AR Connect is a telephone-based counseling strategy to get started, and then they refer you back for longer-term local in-person relations. So I think this is something for us to keep our eye on going forward. With respect to our vaccines, we're almost to 50%. We've got 47% of our population fully vaccinated. We are, in the bottom tier at 42nd, but we're not 50th. And I think we continue to beat the drumbeat. I think most folks that have now chosen to not be vaccinated have made a decision. So I'm really shifting my message to say, let's, instead of vaccinated or not vaccinated, the virus is still present. Almost everybody knows somebody who has had a bad interaction with the virus. Why are you choosing to continue to be unprotected? You're unprotected for yourself. You're unprotected for your family. I think we shared before. If not, I'll send it to you, Tim, to circulate. We had on the municipal league call, we had a plumber from Lake Village who came on with us. He was a complete anti-vaxxer, was an amplifier on the social networks of some of the negative information. He and his family had a pretty close-knit family that he was the leader of. They had a birthday party at the end of June. All 13 of his family members got COVID. 3 of them died. And so he now is a complete pro-vaccine, I think, credible story. And I think these stories that have people rethink their decision about not getting vaccinated and trying to move to a more protected situation, because this virus is not going to go away, because our vaccination rates are not going to get high enough for us to get to herd immunity at any time in the near future. On vaccinations, we are making progress. These are vaccinated residents by school districts. You'll see, up in your area here in the central part of the state, we are, in the 40 to 60% range. That's good. We probably aren't exactly accurate down in the southwestern part of the state because folks go across the line, but it's not too far to your east that you still have some pockets there in the rural parts of the Ozark Mountains where less than 20% of the residents there have been vaccinated. And this is the same number by zip code. We show you zip code because we do have one zip code in western Pulaski County that has crossed the 60% threshold of its residents that are fully vaccinated. And so we wanted to claim at least a little victory for the one green. Look forward, you may have a little green up there in northwest Arkansas. That may be the Fayetteville zip code there in downtown Fayetteville that is green also. So congratulations to you for crossing that 60% threshold. With respect to boosters, we now have strong recommendations for individuals, select individuals to get boosters. For those who got the Pfizer or Moderna vaccine, those that are eligible for a booster shot 6 months after include those that are 65 and up, 18 and older that are in long-term care settings or nursing homes, prisons, and so forth. 18 and up that have underlying medical conditions, and those that are work or live in high-risk settings. This is because it appears twofold. One is it appears that our immunity does wane. It also appears that the variants are more infectious. So those two things go together. And so this recommendation for a booster shot 6 months after, they continue to look at the data, and it may be that in the not too distant future, all are recommended to have a booster shot 6 months after Pfizer or Moderna. For people who got the Johnson & Johnson vaccine, it is recommended for all that are 18 and up who were vaccinated more than 2 months ago to get a Johnson & Johnson booster. And importantly, both for pragmatic considerations to get shots in arms, but also to give choice based upon the data, individuals can choose the vaccine they receive as a booster. Now, this is a little bit logical, and then we've got a little bit of evidence. Obviously, there's a small risk with a new vaccine that you might have one of the adverse allergic reactions. If you got Pfizer and you didn't have an adverse allergic reaction, it's highly unlikely you're going to have any reaction if you get another Pfizer shot. If you start switching, that potential for an adverse reaction is present, although I think it's relatively minimal and very small. There's been one study of about 450 patients that did look at the swapping of vaccine boosters. This is a preliminary study under review, but I did want to share it with you because this is going to be the question that folks want a final decision on, and we don't have it yet. So this is for the three vaccines that people have gotten, either Pfizer, Moderna, or the Janssen vaccine across the top. And the initial dose regimen, 2 for Pfizer, 2 for Moderna, 1 for Janssen. So it compared then for each of those, which type of booster you got, Moderna, Pfizer, or Janssen, in the individuals that had previously had the initial dose of each of those three. And you'll see the measurement of the antibodies, which is the only thing that really can be measured. It varied some between each of the three vaccines. Now, it was good in all, but for example, if you got the Pfizer shot initially, if you got the Moderna shot as a booster, you had a slightly higher amount of neutralizing antibodies than if you got Pfizer or Janssen. Conversely, if you got Moderna first and you got Pfizer second, again, slightly higher, pretty minimal difference. Janssen, it does suggest that if you had Janssen, getting one of the messenger RNA vaccines may provide an advantage. Now, I want to caution here because the antibodies are what we can measure. What you cannot measure are the other memory cell issues, the interleukins that are responded, the lymphocytes and the monocytes that are activated. Antibodies are only one part of your immune response. So I think this is where tracking to see how many of these individuals have better or worse kind of future outcomes with COVID-19 is critically important. But I did want to just share this very preliminary and small number trial that was in the news last week, and I think it's something worth tracking. Now, we do have currently children eligible for vaccines in May, and Pfizer released their study that a lower dose of the vaccine is effective and safe in children 5 through 11. They submitted that to approval of FDA. I think the FDA committee is meeting today, and I anticipate that they will have a decision and that we will have their affirmation of vaccination safety, and it will immediately go to the Committee for Immunization Practices at the CDC, potentially later this week or tonight. And we could have vaccinations available for kids 5 to 11 as early as the next week or so. This would give about 28 million kids the opportunity to be newly eligible. And I know a lot of parents that will want to advance that in their families. We do see from that data that vaccinated adolescents, or from the adolescent data, it clearly reduces the risk of hospitalizations. Of adolescents hospitalized, almost all have been unvaccinated. And importantly, of vaccinated adolescents, we don't see hospitalizations and we don't see admissions to ICU, and we have not seen deaths either nationwide or here in our state. There is still a strong recommendation, but low uptake for pregnant women. As of September, only 31% of pregnant women were fully vaccinated either before or during the pregnancy. The reason for this recommendation is that pregnancy appears to be just like one of those comorbid conditions. If you get COVID while you're pregnant, you are much more likely to be hospitalized and more likely to be placed on an intubator. And unfortunately, if you get severe, compromised and you have to be put on ECMO or bypass, before they heparinize you, they must take the baby through an emergency C-section. So this has been an observation of those that have had bad outcomes. Again, 97% of those were unvaccinated. And so the CDC's call to accelerate vaccination for pregnant, recently pregnant, or those who are trying to become pregnant is a clarion call there also. A couple of new things, right now in the United States, the CDC only has the Delta variant of concern. There are other variants being monitored. Previously designated as a variant of concern were the Alpha, Beta, and Gamma variants. The Mu variant, which originated in Colombia and is in South and Central America now, is a World Health Organization variant of interest. It does show, and you'll recall kind of some of our worst case scenarios, it does show some resistance to the existing vaccination protection that we have. It is not very prevalent yet, so that's why I think it is a variant of interest that's being monitored by the World Health Organization. It is, I don't think it has been broadly identified or widely identified as present here in the United States as of yet, but it is in the Western Hemisphere, and therefore it is a concern, I think, to us. I think we've got Halloween that will be different this year. I think outdoor events, particularly for vaccinated families, for adolescents, I think can go forward safely. I would urge, continued caution. I would probably try to avoid indoor events where, again, if 50% of folks are not vaccinated, the Delta variant is likely to be present. This continues to be a virus that we are learning more and more about, but we don't know everything about. So I think it's something that we want to continue to use caution, although I think we're all looking forward to having a more relaxed holiday period. I said this a year ago that we might have a relaxed 4th of July, so I'm hesitant to say it about the holidays, but everything we're seeing is moving us in the right direction, with the caution that at 40, less than 50% fully vaccinated, the Delta variant, when you're in a large crowd, the Delta variant is still there with you. And we continue our updates. Sandra's team's doing a great job. Tim, thank you for having me back. Be glad to take questions. Sarah, you've got your event coming up next week. My event is on the 15th. We will be honoring one of yours from up in Northwest Arkansas. The former head of the Ozark Guidance Council is getting our Tom Bruce Arkansas Health Impact Award. And so we are excited about doing that on the 15th. And then we'll probably have a small event up in Northwest Arkansas sometime the first part of December to let some of his local champions celebrate with him.
That's great. That's great. Great organization, Ozark Guidance. Okay, questions, everybody. Sarah, we'll give you the first option.
Okay, sorry, someone's working, like drilling outside of my house. So can you guys still hear me?
We can hear you.
Yeah.
Okay, sorry. Yeah, okay. Dr. Thompson, you're awesome. Thank you for being here again, of course. So I have 3 questions. The first one is, I told you about my son and my husband getting COVID, and I was definitely very exposed to it. We're still very careful. I mean, we wear masks everywhere. We don't really go places we don't need to go. But can we feel a little bit of relief? We have a little extra immunity from Delta. I mean, maybe I got it. I took 2 antigen tests at different times and they were both negative. and I never really had symptoms, but I was definitely exposed.
Sure. So I think if you don't have a reason to be immunocompromised and you get and manage through an infectious with COVID, and if you have been infected and gotten the booster, you are optimally protected. You've not only taken advantage of the vaccine, but your body's immune system has been exposed to the full virus and you have survived it and thrived in getting through it. So you are probably the most protected person, in the state of Arkansas now. So you and your husband, can celebrate tonight.
Okay, awesome. Sorry.
I think the thing that is that I want to say to this group, because we have a long-standing relationship, we don't know all the tricks that this virus has. Okay, I mean, we thought last June that we were coming through and we were fine, and yet starting in July and then through August, and we were in trouble again by the end of August. So while I think, particularly Sarah, you and your family can breathe more safely, and we can all, breathe more safely and be less anxious, I don't know that we want to be less vigilant. I will feel better when we go a year or two with no major mutation and no resurgence like we've now had once. It's not on the radar screen now. That slide that says the CDC have no variants of concern, that's the best signal that I can give you. But it's kind of like hurricane season. It's hurricane season, even if there are no hurricanes impending right now, and you just need to keep your vigilance up.
Yeah, well, that's a that's good advice and a good analogy. Very good. Sarah, you want to continue on, or you want to wait?
Yeah, sorry, it'll be quick, but just on that same point, so Delta Plus isn't something to worry about?
I think we're learning about Delta Plus. I think this is one, again, where we're going to have to just watch and see how and whom. Okay, if Delta Plus is affecting the unvaccinated, which is where I think it currently is having its greatest impact, just like Delta is having its greatest impact in the unvaccinated, then what we're going to have is we're just going to continue to have, a fire going on in our communities and in our hospitals. And unfortunately, people that are hospitalized, intubated, and die because they were unprotected. And we've got a new variant that is, more efficient at taking down unprotected individuals. I think we need to watch, again, that worst case scenario is if it breaks through the protection that we have from vaccines. And I don't see that yet. That's where the hurricane warning flags may come back up.
Okay, wonderful. Well, I just thank you for all of your help with our event, and I'm glad that we pushed the date because it looks like we're going to be able to have it safely and vaccinated.
Good.
Taking your advice.
Congratulations.
Looks like a good decision, Sarah. Well done. And good questions. Now the middle down there running that saw, go down there and tell Joe, find a restaurant or something to run. You don't need to be running that saw during our events. All right. But any other questions? Ed, any questions? Douglas, you got to have a couple of good questions.
Hey Tim, this is Bo. I've got a question
bet, Bo.
and a comment. You look really good in that blue suit today.
There's a story behind it. Yeah, thank you, Bo.
Dr. Joe, you mentioned that as it pertains to that newer chart analyzing the initial vaccine you got and then the booster shots, and that the only way to measure that right now is through the neutralizing antibodies level, but that there are a number of other items that aren't being that can't be measured, aren't being measured. Are they correlated to the point that if you're stronger, if the combination of doses is stronger in have the level of neutralizing antibodies, that those other measurements would also be stronger, although maybe in different levels? But are they correlated in that way, or is that not an accurate statement?
I don't think that's an accurate statement. If you think about, and and again, with this group, I can go a little bit deep. You know, your immune system is really, it's remarkable how it's made up of different types of white blood cells. You have lymphocytes, you have monocytes, you have macrophages, you have, we know there are at least 10 or 12 different communication mechanisms between those cells that cause them to react in different ways at different times. We have learned clinically that, you know, part of the challenge, and it may be the challenge in some of our long haulers, is that the immune system gets over revved up and causes some autoimmune issues, you know, that steroids help calm down over time. The neutralizing antibody, we can actually, what they do is the antibodies themselves are in the serum of your blood, not in the cells of your blood. So we can take your blood, they can spin the serum so that it's the juice, if you will, and then they can, what they can do with the antibodies is tell, okay, how many times do I dilute this? And I still see evidence that the antibody is working. That's what those dilutional, you know, 9 times. They diluted it 9, they halved it 9 times, and they can still see effects from the antibody. So in those comparisons, one of them I think was they diluted it for, I think it was on the first column, Pfizer. You know, if you got Moderna, it was 19. If you got a second dose of Pfizer, it was 14. So they're diluting it 19 times. They're having it 19 times or having it 14 times, and they're still seeing evidence of antibodies in the serum itself. So both are really, really good. But what we can't measure, because we're not looking and we don't have good commercial ways to look at the activity of the blood, of the white blood cells themselves, the lymphocytes, the macrophages, the monocytes, which are talking to each other and trying to figure out, you know, how to combat the virus. And so I think, Bo, it's a great question. I think the simple answer is no, they're not correlated, but I needed to go a little deep to give you the reasons for that.
Yeah, thank you.
Yeah, thank you very much. Appreciate your report.
Yeah. Bo, keep going. I didn't mean to interrupt you, Bo.
Just thanking him for his report and the response very much.
Yeah. That was a great question. Appreciate you bringing it.
I'll come back, Tim, and this may be something, again, it is nice to not have to have these on a weekly basis anymore.
Yeah.
Although, 2 things just to draw to your attention. I would, you know, encourage you all to reach out to your school board members and offer them support for what they did when things were pretty rough. You know, most of them now have an opponent in their election that's going to run on this issue against them as a singular issue. And, you know, I think, you know, from talking with some school board members, they're questioning whether they should even run. Okay, so I think a little bit of support there would go a long way. The other thing that I think, and I mentioned it early on, I think for those that are unvaccinated, you know, doing everything we can to get them to rethink that decision. They've made a decision now, probably, that they are going to wait or not get vaccinated, and reframing it for them as you really don't want to stay unprotected. This virus is going to still be around. You don't want to have you or your family be unprotected, you know, and it's baseball season. You don't want to get knocked out of the game before you even get to the plate. You know, I think any of those conversations you can have, you know, Sarah, at your meeting, asking folks to really, you know, think about how we get as many folks protected as we can. I think we're coming through it. We're all going to relax. The threat is still going to pick people off, you know, a dozen at a time, and we're going to lose folks that we otherwise wouldn't have to.
Yeah.
I have a real quick question.
You bet. Please do.
Dr. John, I'm asking you to put on your speculative hat, which I know you don't really like to do, but for those of us who are older, and I'm thinking particularly of my 91-year-old mom who's got respiratory problems, do you anticipate that we're going to need to continue to get booster shots every 6 months?
Great question, Ed. And you know, I think we got 2 things going on here. One is, you know, continued because this is a new virus and these are new vaccines, we don't know how long our immunity will last against the existing kind of coronavirus that we know. The second moving part are the mutations that the coronavirus will continue to do. It may emerge to be like the flu virus, where it changes slightly each year. And if you want to protect yourself or your mom, you want her to get an annual coronavirus vaccine. There is a vaccine manufacturer now who's putting the flu virus and the coronavirus vaccine in the same vaccine, so that maybe it's a combination vaccine like measles, mumps, and rubella. We had combination vaccines for our kids. So I think the short answer is, I think it is not unlikely that we will need booster shots in the future. I think it is unknown now, how often and in what, delivery mechanism. It's pretty amazing that 24 months ago, none of us knew anything about coronavirus. And with the scientific, acceleration that we've got, a 95% effective vaccine against a worldwide pandemic. Now, some of the other knowledge that we've had has gotten sidetracked through misinformation and other things, but I feel fairly confident that our vaccine development, testing, oversight community is going to give us good information of how we optimally utilize that tool. I think it's our challenge on getting people to take the tool that will continue to be, the threat.
Yeah, that slide that you put up about how many deaths could have been avoided it tells the story, doesn't it? That's really a great slide.
And we put that out, not necessarily with the health department or the governor's, support, because it just was, once, and we're not saying all deaths are preventable, but the health department's own data is saying 90% of the deaths are in unvaccinated people, and it's time to start treating those deaths as what they really are, which are lives lost that were not necessary. Yeah,
it tells the story. Seems to be very true. Other questions?
I have one more.
You bet.
So last time you kind of got into an explanation about how boosters, the longer you wait to get a booster, the better the better your immune system responds, or the longer it'll work. And I think you told us that we got those two original ones closer together because we were in a pandemic, right? So, but for the booster, like my parents both got their booster because they're of the age, especially when, my family started getting COVID, they're like, we need to go get boosters right now. But for people that are younger and relatively healthy, is it better I know we're not even eligible to get them right now, but would it be better to wait a little bit longer if you can, or is it better to just get it?
So you're asking an impossible question, but I'll give you the best answer that
I do that to you. I'm sorry.
Okay. All of our bodies react slightly differently to the vaccines. So there's no absolute right answer to your question. Somebody who got the vaccine and their immune system didn't take it as assertively and imprint the profile of the virus so that it knows what to watch for would need a booster sooner. Somebody whose body really took it up and has a hard imprint of it could get the booster later, but we're not going to know that. So that's why I think the follow-on studies that the vaccine manufacturers are doing, where they say, on average, here's when immunity starts to wane. Therefore, here's when you should start to seek out a vaccination. Now, going back to what I said before, and Sarah, thank you for your recollection. The spacing in the original shots, Moderna and Pfizer, the twofold, and you'll remember Pfizer was 3 weeks apart, Moderna was 4 weeks apart. That was based upon previous vaccine understanding. When the vaccine manufacturers put their trial together, they didn't know whether it should be 3 weeks or 4 weeks or 5 weeks or 6 weeks. So they picked 3 weeks, Pfizer did, and Moderna picked 4 weeks. And so that's what the study was based on. And so that's what the recommendation was. And that's what the CDC said yes to. And that's what we got. After you have that initial imprint, then, you don't want to get your booster prematurely before your immunity starts to wane, because the imprint won't last as long into the future. So that's why I think it's really not an individual decision about when you want to get your booster. I think it's really should be based on the data and the review of the population of people that they're tracking to say, in the general population, when does your immunity start to wane? Now, in your situation, having just had COVID, you probably can stop watching TV for a while to see when your booster is going to be needed. But it'll come at some point in the future. And actually, we may have data on people that have had the vaccine, then had a breakthrough infection. They're tracking people over time so that we can know how best to manage this threat in the future.
Yes. Okay.
Thank you.
Steve McBee, good to see you.
Good to see you too. I do have a quick question.
Good.
Dr. Joe, what do you think that we've learned in the last 24 months with the time, effort, and energy that we put into solving this very complex problem that we could apply to this 50-year war on cancer?
Yep.
Great question.
That is a great question.
Well, and I'm asking for personal reasons, so.
Okay.
Yeah.
Steve, I'm going to answer it in two parts. The first is going to not be specific to cancer, and then I'll come back in the second part and have it be specific to cancer. I think what we have learned in the last 24 months is, on the one hand, how exceptional the scientific and the clinical community can respond to a threat, but how weak our healthcare system is in responding to a threat. I mean, it really showed the weaknesses. I mean, the fact that we didn't have a stockpile of face masks when this thing broke out, or gloves in the right place, or we had all the supply chain issues. And we're not even talking about the inequities that we saw with lower income communities and minority communities being disproportionately affected. I mean, we're going to see that the ratio of deaths in Black and Hispanic folks to whites is going to be shocking. And that's not because the virus attacked them any more aggressively. It's because they were less protected or less able to avail themselves of healthcare and the services. So, I think we should be impressed with our scientific ability. We should be really, we should really take a tough look at our delivery system. Our delivery system is really set up to operate on people. It's not set up to take care of people. And so we need to really look at that in a different way. Now I'll spin to your question of, I think the science, I think the genetic potential to profile. I mean, we got the genetic code for this virus within a month of discovering the virus. We need to figure out, cancer is a genetic mutation of a human cell that gets out of control, and your body can't, regain that control. So therefore you have to go through the therapies to try to ablate that malignant cell, and you have damage to healthy cells in the process. If we could take the genetic knowledge, and I know people are working on this, to end up with it's almost like a cruise missile, like the messenger RNA vaccines on cancer cells. Now, the challenge is, and I want to not go too far out on the thin ice, the challenge is, while we have types of cancer that we call leukemia or breast cancer or whatever, just like the variants in this virus, our cancer cells are probably genetically different in each one of us. And so, the leap from getting a sequence of your cancer cell to a cruise missile for your cancer cell is a bigger leap than it was for this RNA virus. But I think that's going to be exciting in the future. And I think it's important. I think the third piece, and I'll just put this, it goes back a little bit to the first statement. We had a lot of folks I'll just be blunt. We had a lot of white collar folks that successfully survived because they could work from home. And we had a lot of frontline folks that had to go to work each day to put food on the table or to keep our grocery stores filled. And we're going to see the difference there. We also have accelerated or increased the digital divide for folks that are internet connected and were before the pandemic, or even more so now. Folks who are not interconnected before the pandemic are much less so now. And you know, I think these are all things that affect our community. I know, Steve, your questions was specific about cancer, but I think there's just a broad waterfront here that if we could all sit down over a good bottle of wine and dinner, it would be a very interesting Monday morning quarterback to say, what could we learn from this and what should we learn from this to think about how to construct our community, construct our healthcare system, you know, construct our preparation for the future in a different way.
Okay, follow-up question, Steve, or comment?
I'm going to consult with Sarah on where to go for good wine and dinner.
There you go.
So,
I like it. All right, we'll be looking for our invitation. We'll be there. Great to see you. Great, wonderful question.
Dr. Thompson, I'd be curious on, for those with kids under 5, what is the general thinking there? Like, we obviously would love to use preschool or amenities at some point in the future.
Yeah, I think, you know, there are studies underway. Obviously, the younger kids, there are greater concerns about potential safety issues. There are also more challenges about appropriate dosing. How do you give the right dose to get the right response with the minimum number of side effects? I think we will end up with vaccinations for review by the end of the year, probably for kids less than 5. You know, I think luckily, while kids less than 5, Sarah's example, can get COVID and do get sick, we're in my conversations with the folks at Children's Hospital here in Reflected Northwest Arkansas, it's mostly teenagers that are getting bad sick. And so I think we're still lucky in that regard, is that this virus, you know, appears, I mean, it's moving down the age range, but it's not yet severely in the very young. And so maybe we're in a little bit of a race there to get a vaccine before it changes its characteristics again. But I'm optimistic that there will be the opportunity for protection of younger kids, you know, before spring and maybe even by the first part of next year.
There we go.
And I'd go back to, you know, this is not an all clear signal. If you go to Walmart, COVID is there. I mean, if you go to a crowded restaurant, COVID is there. I mean, you've only got 50% of folks vaccinated, and you've got, you know, hundreds of folks in the hospital and, you know, hundreds every day newly diagnosed with a new infection. So it is still prevalent in our communities. The volume of threat is coming down, I think in part because we've had such amount of spread, but we're still going to continue to have this. I mean, the forest fire is, how do they say it in California? It's 75% under control, but 25% now not under control. So,
Yeah,
you know, that would be my prognostication right now.
yeah, 50%. That's a lot of kindlewood. Yeah, sure is. Other questions?
I would, and I'll just say this, you know, next week is November. And I probably need to think about putting this into conversations with other groups. You know, it is time to start having the family discussion again about, you know, are you going to have folks be protected as they come together for family, you know, events over the holidays? I think if everybody's protected, the level of, you know, fun, enjoyment, risk mitigation will be optimal. If you're mixing and matching, then you are playing a little bit with fire.
Yeah, well, thank you for that. And I can't tell you how much we appreciate all that we've learned from you over the last 24 months and how we were able to make much better decisions.
I was on a call yesterday. They were doing taping a call for an upcoming kind of national meeting at the National Institutes of Health. And I said, I said, the important thing here that we need some study on and some serious consideration is the communication issues around this. I mean, you can't talk science to 300 million Americans and hope that it's going to actually all resonate and everybody's going to, follow the same path. I said, we've now got 300 million junior epidemiologists across America. It's time to figure out how to use their awareness and get them understanding a little more. And y'all may have graduated from junior epidemiologists to assistant professors. So anyway, thank you for your time this morning.
Well, we do appreciate it. And we do feel like we're been very much better informed by your great communication, and we'll never forget it. And look forward to paying that back to you in any way we can over time, you and your organization. Any other things y'all want to talk about? I think the one last thing I might mention before we wrap up is this mental health issue. As over time, if you think about what some of the people have been through, and I still worry about the hospital workers and people, organizations like yours, Dr. Joe, that have just had to fight COVID every day, and I'm sure it gets old. We think it gets old to us just coming on for some 1-hour chats. It's got to be getting really difficult for a lot of people, and I think we've all got to keep our empathy level way up. Even our coworkers, we don't know what they're going through. We just have to be real patient and real caring. And I think it's a time for leaders to have more empathy than ever. I mean, I think it's going to be needed, and I wish we were plugged in better to some good communicators of mental health that we could get together with in our groups anyway. If anybody knows anyone who's just a great communicator that can just put it out there and so well, that I think that'd be something we
David Williams, who's getting the award.
Yeah.
Is he a good communicator that way?
Yeah, David Williams, he used to run Ozark Guidance Center. He's fantastic. Him and his wife Patty both are, but he's amazing.
That's who you went to early on for some advice, wasn't it, on some other things? Yeah.
Yeah, with our orphanage. Yeah.
Yeah.
He's
Okay.
fantastic.
I remember that. Yeah. There you go. Well, see, ask and may receive. Well, we may be reaching out to him if he's still doing things, but yeah. So I thought I did encourage everybody else as you lead and just maybe be aware and have your antenna out for anyone who may be struggling more than we realize. So I think this thing has got a tail to it. It's got a little hangover to it that's going to go beyond just dealing with the virus itself, as you can appreciate. Good to see everybody. McBee, thank you for your brave question. That's awesome. Hope you're doing good. And we're with you. You're in our thoughts and prayers. And everybody else, good to be with you all. And we'll adjourn at this time. Thank you.
Thank you.
Thank you, Dr. Thompson. Thank you, Tim.
Thank you, Dr. Thompson.
Sure.
Thank
Have a
you.
great week. Be careful.